This first question is about helping older adults in the community. For return of helping to care for older adults, if an older adult is vaccinated and a volunteer has been as well, is it safe for them to resume in-person connection?
I'll take a first swipe at this one. Thanks for that question. I think that's kind of the thing that's on everybody's mind is when can we kind of get back to normal, both as individuals and maybe also as a society. And definitely there is much reduced risk if both of you have been vaccinated and if both of you have had the sufficient amount of time after your second vaccine to have developed appropriate immune response. Where we can have some risk is if one of you has not developed enough of an immune response to prevent you from being infected. Now, that probably is much greater on the side of the volunteer because the volunteer is more likely to have contacted a lot more people than it is on the side of the older adult who may still not be, circulating in society to the extent that the volunteer is. So I think the way to approach this, at least for now, until more and more people are vaccinated and less active infection is out there, is to wear masks and to be very cautious and take, all the precautions we've learned about washing hands and those kinds of things. So I think if you're wearing appropriate masks, both of you are vaccinated. I mean, it's not zero risk, but the risk is extraordinarily minimized that either of you would infect the other and be, to the extent where you would have severe disease. So that would be my initial thought based on that. I know Bob may have some other comments.
I really would just second what you said and encourage people to continue wearing their masks until we really get a much lower incidence of disease in the overall population, when herd immunity really starts to kick in and the curve of new infections really is on a downswing and continues on a downswing. And John will probably speak to this later a little bit too when he talks about some of the masks, but still people tend to not wear the mask correctly and think by covering their mouth and just faking that they're breathing through their nose, I guess. Noses really are connected to your lungs, and that's part of your respiratory system. And this is a respiratory disease and transmitted from one person's respiratory system to another. So continue to wear the masks until we're really on the downswing of this, and then continue to see what the public health advisories and public health information is.
Thanks. And related, so then can vaccinated people still transmit COVID-19?
Yes, they can. And the possibility of transmission or the probability of transmission is not nearly as great as it is if you're not vaccinated. I've looked at a lot of different sources of information on this because this has been a question that people have asked periodically and quite often, really, ever since we had the vaccines rolled out and people were starting to become vaccinated. The incidence of transmission from a fully vaccinated person who probably has at least 10 days to 2 weeks past their second immunization, if they're on either the Pfizer or the Moderna vaccine schedule, after they've had their second and after they've had 10 days or 2 weeks for their immune response to really develop the best immunity probably that they can at that point, then their chances of transmission or their probability of transmission are much less. I would not say absolute zero, but really does knock down the possibility of transmission. It takes it from the amount of virus in the person's respiratory system. It's not able to multiply like it could if you were not vaccinated. And you need a little bit of time also if you're exposed to the virus. If let's say you're exposed to a really heavy infectious dose from somebody, even if you're vaccinated, it takes a few days for your body to get the immune system kicked up to the point where it's going to eliminate the virus from your system. So still be a little bit cautious. The possibility and probability of transmission from a person who's been vaccinated are extremely less than if you're not vaccinated, but still, it's not absolute zero.
Oops, I was muted. I did want to just sort of add a couple comments on there. I think Bob has a really good point that the risk is not zero, but it's massively decreased that you could be infectious to another person if you've been vaccinated. I don't know that the messaging around this in the media has really done a very good job at sharing that. We tend to be more, we tend to focus more in the media on uncertainty than we do on, kind of what the promise or the hope is with the vaccine. And what we all hear is, this vaccine is not a get out of jail free card or get out of COVID free card. And that is true, because there hasn't been enough people vaccinated to ensure that we can stop the massive propagation of this virus throughout the population. But it eventually will likely be one of the tools, and the major tool that will get us sort of on the other side of this pandemic. So I think the take home message is, yes, what I worry about, I guess, is that people are like, well, if I could still give it and we're not even sure if it works in 100% of people, then what's the point? The point is that it works in 95%, at least as far as we know. The other thing is that when they did the initial studies for the Moderna and the Pfizer vaccines, they didn't actually study whether or not people that were vaccinated could be mildly infected and give it to anybody else. They didn't look at it. So it's unknown, but if we think about all the other vaccines we have, developed over the many years, the likelihood is that it will behave in similar ways as other vaccines, in that once you've been vaccinated, the likelihood that you could get infected to the extent where you can infect another is very low, 5% or less. And that is basically based on the number of people that maybe that 5% that don't create that super good immune response. So I want to share that just because I think it's important that we lead with hope here instead of, the uncertainty, because there's always uncertainty in science and medicine, right? We don't always know a treatment's going to work, but I think there's a lot of hope. And I think that should be the message. I'd also like to hear from Dr. Volkins, who may have really a slightly different opinion. I don't know, but I'd love to hear his expertise on this as well.
Yeah, no, my opinion's right in line with what you said, Nicole, and Bob as well. I think the other thing on the hope front to be clear about is, yes, while it's possible to get infected, or infect someone if you've been vaccinated, although that probably goes way, way down. The good news is that your chance of a severe infection or a hospitalization goes even farther down. That is the best news about these vaccines, because I think we can all live with getting a cold or the flu a couple times per year. We've been living our lives that way, and we're okay with it. No one is okay going to the hospital, right? I mean, that's just a horrible experience. And these vaccines are showing that they are keeping people out of the hospital and keeping the infections from becoming severe. And that's really the goal of these vaccination campaigns. And so that is really our goal for herd immunity, is just to cut out the hospitalization rate. So I suspect that when you see hospitalization rates going into the single digits, across the country, that's when we're going to see, these restrictions start to get pulled off, because the whole point of this is to save lives. If you are vaccinated and you are infected, you are likely to have mild symptoms and very, very unlikely to go to the hospital.
Awesome. What about the variants? Does the current vaccine work with those? If not, will a booster sort of address that?
I'll start off the discussion on that. And to date, it looks like the vaccines are still effective against the different variants that have been identified, the major variants. Now, there's going to be other variants popping up from time to time. And as we keep going forward with a vaccination program, we'll probably see more of those. But as long as the variants are not affecting the protein that allows the virus to attach to your cells, the spike protein. As long as that protein stays pretty similar, then the antibodies can still, and the cell-mediated immunity are still going to be effective against the variants. And one of the advantages that I've read about with the two different mRNA vaccines, the Pfizer and the Moderna, is that they could add some other mRNA to some of their vaccines that would take into consideration some of the variants. If there are variants that start to show up that are not effective or not combated by the current vaccines, and they could do that much quicker and much more effectively than the traditional vaccine models would be able to do it, or the traditional methods. So right now, we're in good shape as far as the variants are concerned, and it looks like that's going to carry for a while. As Nicole said, as others have said, this is science, and this is a virus. It's a living particle. It can mutate, and it does continue to mutate, and we just need to keep up with that as we're going forward. There are centers around the globe that are studying the different variations, the different mutations of this virus. Probably millions of different COVID-19 viruses, or the SARS-CoV-2 virus, have been totally sequenced, and then they're compared all the time to find the differences and make sure that we still have effective vaccines.
Bob, I love that that answer. I think that was a really well put answer. I think you touched on this, and I think the perspective that the public needs to remember is that viruses always mutate. Like, this is a normal thing. The cold virus mutates. That's why you can get a cold multiple times a year. So this is not, the mutation piece is not something that's concerning. The variants that have been identified as changing how the transmission occurs. In other words, they're more contagious. That's where that becomes a concern, is in an unvaccinated population. And yes, we have to be vigilant about mutations that might make vaccines less effective. But for the moment, we look like we're doing good. So what is the best way to protect yourself against variants? Get vaccinated. Because the way in which we can get rid of this, or at least damp it down to the place where it's just essentially the same as the cold, a common cold, is to have enough people with enough immunity that there just aren't enough hosts for this virus to run around in and continue to mutate and create havoc in populations that are, quote, naive, meaning that don't have immunity to the either to the virus or via vaccine. Another really good piece of news that's come out recently is it appears that people who have been naturally infected with COVID versus people who have been vaccinated against COVID, the vaccinated population actually has stronger immunity. So if you have had COVID and you've recovered from COVID, you should still get vaccinated, because that will boost your immune system to the extent where you're going to be more protected against variants that either are present now or may arise in the near future. Dr. Volkins, did you have some thoughts?
Yeah, I'll weigh in on the variants from an environmental standpoint. There's no evidence in the literature that the variants are more infectious for what they do in air or in the environment. So all of the protective measures that you take now to safeguard yourself will apply to these new variants. So masking and social distancing being the forefront, and obviously hand hygiene and other hygiene, being a close second. The reason the virus is more infectious is likely because of how it acts inside your body once it gets in. And so things like wearing a mask, keeping your distance, staying away from crowded spaces indoors, those will remain to be just as effective at protecting yourself as they were beforehand.
That leads into my next question, which was, I've heard the new variants are much more contagious, so should I just use the same precautions?
Yep, and I hope I just answered that question with my last comment. But yes, the same precautions you've been taking are just as important, and frankly, more important now, because the reason the variants are more infectious likely is that people who do get infected carry more virus in their bodies, and so they can shed more virus. So wearing a mask, washing your hands, social distancing, and staying away from crowded indoor spaces. Really, it's staying away from strangers too, is going to keep you the safest.
Thanks, John. How can I confirm that I'm on the list for vaccination, especially if I'm in one of the top tier categories?
Yeah, this has been a really confusing thing for a lot of people, and it does vary from county to county and state to state, but pretty much throughout Colorado, which is most of our audience today, you would be typically contacted by your primary care physician if you're part of a health system. So the big ones in this area be UC Health, Banner, et cetera. They would typically be reaching out to you by email or phone call. One thing that I have heard is happening in the community is that, emails go to spam, or, someone who is not that tech savvy and who's not checking emails regularly. And there's this window that opens where you can sign up for an appointment to get your first vaccine, that then after a period of time closes, and then you have to sort of go to the end of the list again in that tier. So what I would suggest is, be preemptive, call your primary care physician or whoever you use for your medical care, ask them, tell them that you're on the, you're in tier 1A or B, whichever, or tell them your, age, et cetera. And then have them direct you to their portal, their patient portal, or have them do it for you over the phone so that you can get on the list. There is at the Colorado Department of Public Health and Environment, there is a website there where you can look at, there's a phone number, and we can pop this in the chat, where you can call. It's a 1-800 number, and they will give you all the different websites and sites to call if you don't know where else to go. So it kind of covers anybody who doesn't necessarily, kind of associate with a single primary care facility, or may not have a doctor, or someone who just moved to the area, for example. And then you can look on those websites for appointment scheduling. And typically they will open and close those appointments as vaccine becomes available. So just because on one day there's no appointments on one of those websites, you can visit the next day, you can visit at the end of the day. It is a bit of a pain, but that would be the way I would, advise you probably to get on the list.
We'll grab that number for you guys and put that in the chat, and I'll have it on the recording as well. Next question is, I have heard about KN95 masks and their effectiveness with regards to the virus. What makes them different from N95s, and should we be using them?
Yeah, so a KN95 is a Chinese standard for N95. And there are other masks like the KN95 out there, so I might as well mention them now. There's a KF94, that's a Korean standard. And there's a mask called an FFP2 mask, that's a European standard. All three of those masks are required to have this relatively close to identical filtration efficiency as an N95. So those masks, the KN95, the KF94, the FFP2, all should have high filtration efficiency. However, all of those masks differ from the N95 in a very important way. They tend to come on the market as ear loop style masks. And what I mean by that is they have the mask where you have little ear loops, and that's how the mask gets affixed to your face. I can tell you from experience and from data we've collected that ear loop style masks do not fit as securely to your face as a band or strap style mask where you've got the mask going behind the back of your head. You'll have a hard time ever finding an N95 on the market that has ear loops. And the reason is that the N95 standard, which is only certified in this country, requires that the mask also fit to your face effectively. If you have a mask that has a really effective filter, but it's held off your face by a couple inches, it's going to do nothing. None of the air will go through that filter. The air will go around that filter. So leaky masks are one of the biggest problems we have out in the world today. This is the reason double masking actually has been recommended. Double masking isn't recommended as much because you need 2 layers. It's because the one layer you have likely leaks around your nose and it leaks around your cheeks. And so the double mask technique is to take a good mask like a KN95 or even a blue surgical mask. Those blue surgical masks have effective filters, and use the second mask to hold that mask tightly against your face. If the mask does not seal against your face, then it is not going to do its job, because air is going to always follow the path of least resistance. And the path of least resistance is often around the bridge of your nose. So this brings up my next point that I almost always make when I am asked to talk about masks. How do I know that my mask is sealing to my face? There are a couple good tests you can do. And unfortunately, most masks that I see people wearing are not well sealed to their face. The simple test is to see if your glasses or sunglasses fog up in the morning on a cool Colorado day. If your glasses are fogging, that means that air is leaking up around the side of the mask. And if it's leaking out upon exhalation, and that's your hot, warm breath fogging up your glasses, it will also leak in upon inhalation. And that's not a good thing, because that means that air is not going through the mask. That means that the mask is not filtering. And if the mask is not filtering effectively, you could be inhaling the COVID virion if it's airborne. Okay, so one way is the fog test. A second way, if it's too warm or you're not outside, is you can put yourself in front of the mirror, put on your mask, and breathe out forcefully, like you're blowing out a candle. If you breathe out forcefully and you blink, that means that air is shooting up around your cheekbones and hitting your eyes. And whenever air hits your eyes, you blink as a sympathetic self-protective mechanism. So the blink test is another way you can tell if your mask is fitting. Unfortunately, most masks that I see on the market do not fit well enough to pass either of those 2 tests. So what do you do then? Because we can't find N95s. The thing you can do is either double mask with a cloth mask that ties in the back so that it pushes that mask to your face, or you can wear what's called a mask fitter. These are silicone braces that essentially kind of form a web around the mask and hold that mask tighter to your face. If you go to a website called Fix the Mask, I think it's .org or .com, they'll talk about braces, and they're not the only source of braces. I think you can find these mask braces or mask fitters on Amazon.com as well. Okay, my spiel is over.
Those are some great tips and tests. Next question is, I have been feeling a lot of anxiety about getting sick. I'm afraid I'm becoming a hypochondriac with every sniffle. Is this normal? What's the best way to know when to worry?
I will take a first stab at that. I don't think many people would have what we used to call hypochondriasis anymore, because I think it's pretty valid to be concerned. And hypochondriasis was really sort of this unwarranted concern about your health. I think because we have sort of taught people to be overly, or at least be very keenly aware of their symptoms, it's fine to be watching. What you don't want to do is start to have your sort of preoccupation with symptoms really interfere with your life. And so in terms of being concerned, you can try and be proactive. And if you feel like these are symptoms that if you do sort of a checklist and you say, have I had these before? Was this part of my life before COVID? Do these come and go in my life? And you do a reality check and you sort of feel like, no, these have sort of been a part of my life. I would do those reality checks and see if this is really something new. I wouldn't go and search, is this a symptom of COVID all the time? Because as you've probably noticed, there are lots of symptoms of COVID. So because you have one or two doesn't mean that you have it. I think it's fine to go to the CDC and look at the sort of most frequently reported symptoms and see if you're matching. If it's troubling you, then go and get tested, or buy some kits even to have at home that you can test yourself if you're feeling like it again is interfering with your quality of life. And then I would kind of remind people that, so we in psychology don't really have hypochondriasis anymore, but we do have anxiety-related disorders about illness. And that's what they are. They are anxiety-related illnesses. And so I would also suggest, if you feel like this is causing you problems in terms of your health and your inability to relax, or to attend to things, to treat this like an anxiety disorder. And we've talked about this quite a bit. Treating anxiety disorders ranges from meditation, deep breathing, finding things that relax you or occupy your time and space in a positive way, to talking to a counselor. There are all sorts of online groups too, that if people want to sort of connect and say, is this normal what I'm going through? I think you would find that there are a lot of people who are experiencing anxiety around COVID. But I would just, my suggestions would be to do those reality checks and sort of say, how does this fit with my normal functioning? If it sort of progresses beyond that, then go ahead and get tested, and then recognize the anxiety part of that, and start incorporating some anxiety reducing parts in your lifestyle.
Thanks, Deanna. Speaking of symptoms, loss of taste is a common symptom of COVID. How does that happen? Will it affect my taste forever? And is there any way to get it back?
Well, actually, it appears that it's the sense of smell that is altered, but smell greatly influences our ability to taste. And the cause is still being researched, but the virus may cause an inflammatory reaction within the nose, and then that can lead then to interference with the neurons and impact our sense of smell. But this is really interesting symptom and one of the early symptoms, and it's reported by up to 80% of people that test positive for COVID-19. And it's tricky because it's hard for us to measure our sense of smell, to be able to report this. And last month there was a good report in the Journal of Internal Medicine, and I'll put the link in the chat, that reported that the average duration of this loss of smell in a wide survey of patients that they did was about 3 weeks. But remember, this was self-reported, it wasn't measured analytically. So we're still, they're still trying to learn more about this all the time. And after about 2 months, then 1 in 4 cases still reported experiencing some loss of smell. So they're recovering, but slowly. And then after 6 months, 5% of the people that experienced loss of smell still hadn't fully regained that. But it's definitely an interesting symptom. And I learned in reading some of these articles that it's more prevalent in mild COVID-19 illnesses than in the moderate to critical form. So having that symptom may be actually a good sign in many ways. I'll put that link in the chat, and that's what I found out.
Thanks for that. Any tips or tricks to help with post-COVID-19 symptoms like shortness of breath, foggy head, and random heart rate spikes?
I can start on that question. So of all of those symptoms you just described, the random heart rate spikes concerns me and should concern you enough to have a doctor take a look at you. The reason the random spikes in your heart rate is concerning is because there are some people who develop inflammation of the heart muscle as a result of being infected with the SARS-CoV-2 virus. And that can actually lead to something called arrhythmias, which are abnormal rhythms of the heart. A lot of people have arrhythmias just from drinking caffeine or being stressed. You might feel your heart pound a little bit or speed up a little bit. And you can kind of tell because it gives you sort of a sensation that you want to cough or maybe a little bit of breathlessness. Anything that you see that's just, really not associated with that, or if you've had COVID-19, I would just get that checked out. I would be a little bit more nervous about that. Now, so that's one thing. I think the foggy head, the fatigue, those are really common results of being infected with COVID. Don't seem to be associated with any kind of, severe health problem. But there are things that mess with your life, right? And so I understand, why the question, is there anything we can do about this fogginess? It does go away. Some people have it for much longer than others. The fatigue especially seems to hang on for a while and sort of comes and goes as you get further and further down the road. Things that you can do just for general fatigue treatments would be things like ensure that you're eating a good diet. I think that vitamin D supplements, if you are, and speak to your doctor first before starting any new supplement, but a vitamin D, especially here in Colorado, where a lot of us tend to be a little bit vitamin D deficient, that can really sap our energy. And then if you add on, recovery from a virus, et cetera, it just kind of exacerbates that or makes it worse. You could also think about your B vitamins. Usually B vitamins are delivered by injection. So that's another option. Again, these are just things that generally for people who are having fatigue help. It may not specifically help with COVID fatigue, but what it will do is, kind of boost things surrounding that so your body has a chance to recover more quickly. The foggy brain is often associated with the fatigue piece. There has been a lot of research on, are there long-term brain effects from COVID-19? And there are some people that say that that can be a very long-term problem, is this fatigue, this fogginess. But for the vast majority of people, that goes away in weeks or sometimes a couple of months. And it does go away faster if you can support yourself in other ways, so that you're getting enough sleep, you're getting good nutrition, you're getting some exercise, you're getting outside safely. And then you're supporting yourself through, whatever things that, just checking your vitamin D, vitamin B levels that your doctor can check with a simple blood test.
Great, thanks. How do I grapple with thoughts of missed opportunities in the past year? COVID has delayed my career plans. I'm also single and I stopped dating due to safer at home orders. It's hard to not get depressed when thinking about the valuable career and personal developments I've missed over the past year.
So I'm happy to take a stab at this. If you look around at sort of the psychological effects of COVID, there are a lot of people who are trying to make sure that folks know that it's pretty normal to have feelings of grief. And so I think that's one of the things that we're telling you is if you lost something or lost an opportunity during COVID, it's really important to recognize it, to validate it, to treat it like you would grief, a loss of anything. You can do that on your own. I mean, you can journal about it. You can talk to people about it. I think it's really important to talk to people who are empathic and will sort of support you in this idea that this is a real loss. Then the other part is, I think, trying to be really proactive moving forward in terms of alternative options. We're not out of the water in terms of like COVID yet, so we still probably have a little while longer while we're going to have to be having an altered lifestyle. And it's really important that if you are someone who has felt like you've had a lot of loss, that you start thinking about alternates. So if you didn't have the family reunion that you wanted, that you start trying to maybe get the family connected and doing something virtual. And it's not exactly the same, clearly, but it is important if you are someone who's feeling like you're just losing sort of all facets of your life, that you start connecting with people in terms of figuring out ways to do alternatives. I've sort of said this from the beginning, this is not like a waiting game where you should just put everything on the side burner until the end, because you need social interaction, you need stimulation, you need engagement. So I would say sort of reach out and find friends or professionals that can help you walk through the grief process with things that you feel like you've missed. And then moving forward, try to figure out ways to at least get some sort of partial experiences that are safe, where you don't feel like you've lost out 100%.
Thank you so much. That is all the questions I have that have been sent in. If anybody in the chat has any questions, or if anybody wants to unmute and ask a question, that would be great.
I'd like to follow up on a question that was proposed, and that was, are we likely to have a situation with COVID-19 like we do with the flu shots, where we'll have an annual booster? And another part of that question was, what would it take to eradicate COVID-19 like we did with smallpox? So those are two very different viruses, first of all. So they cause the diseases are very different. Smallpox was much more devastating than COVID-19. The viruses are in no way even related to each other. The only similarity is that, yes, they are viruses. Smallpox, the only host for smallpox is the human. There are not other mammalian hosts. There are no other reservoirs for it in nature. Whereas with SARS coronavirus 2, we know that there can be other reservoirs such as mink and ferrets. We know that then probably other Mustelidae that are related to these two species could also be infected and be reservoirs out in nature. We also know that cats and dogs, for example, can be infected. They don't seem to be near as severely infected. Dogs probably do not transmit it, and if cats do, it's very unlikely, but they could possibly transmit the disease to other cats or to humans. So we have a real different situation here between these two viruses. The other thing is that the vaccine for smallpox that was developed in the late 1700s by Dr. Edward Jenner in Berkeley, United Kingdom, was a very, very effective vaccine, and it was a live virus. It was a virus that was related to smallpox that was derived from cows. So the lesions on cows' udders that were caused by an infection with cowpox, then those scabs were collected and powdered, ground up with mortars and pestles, and then scratched into the arms of people to vaccinate them. And that worked. It worked really, really well. It was a very solid immunity. It took from 1796, when the first smallpox vaccine was done, until 1980, before the disease was considered eradicated. So we had quite a bit of time there that people around the world were vaccinated. There was also, if you go back and search for some of the cartoons that were circulating at that time on smallpox vaccination, it showed people growing horns and growing cow leg out of their arm where they were scratched with cowpox and all kinds of things, not too unsimilar to what some of the blowback we're hearing now from people that do not want to be vaccinated with the COVID vaccine. And those smallpox, cowpox cartoons were totally false. And we've seen that the science behind the COVID vaccines also is a very solid science. We're having very good responses to these different vaccines. Will we need a booster of these? We don't know that yet. We've only been vaccinating people since December, and so we really don't know what's going to happen with that. My hope would be that we have something like our tetanus vaccines. We're supposed to get a tetanus booster every 10 years. And some people do, some people don't, but that's still a recommendation. It would be great if we have a recommendation to have our COVID vaccine boosted every 10 years. The other things that we've already discussed that may have a bearing on whether or not we have boosters is what happens with the variants. And there were no variants with smallpox, but with COVID, yes, or the SARS-CoV-2 virus, we do have some variants, and we need to keep studying this. And several of us have mentioned over the past, we've only been vaccinating since December as far as mass vaccinations are concerned. But I think as we go forward with this, we'll know in probably another year or so, are we going to need boosters, and are we going to need to have some variants, some of their antigens added to these vaccines? So right now, no, it's not going to be like flu, which does some major mutations every year. That's why we have different vaccines from year to year for flu to address the most recent variants of the flu virus. But we'll just have to see. And I know that's not exactly the answer everybody wants, but as Nicole said earlier and other people have said, we're dealing with the science here. We don't know. We don't have a crystal ball that's going to tell us exactly what is going to happen with the future of this particular virus and the variants from this virus. So vaccines working, get the vaccine. There are some real imaginative anti-vaxxer videos that I've seen that people are taking bits and pieces of actual facts. In other words, they're taking some facts and really skewing those facts to come up with a message that's totally erroneous to try to convince some people not to get vaccinated. Like we've mentioned from time to time, consult your own physician, your primary care physician, and make sure that you are a person who should be healthy enough to be vaccinated and then get it. So that's what I've got to say about that right now.
Bob, thanks so much for bringing that up. I think it's you brought up some really important points. And one that I want to emphasize is we don't have to eradicate SARS-CoV-2 to be out of the pandemic. And Dr. Volkins also brought up this concept that if enough people are vaccinated, the coronavirus may be here because of a lot of reasons, some being unvaccinated people, some being animal reservoirs that just the virus hangs out in and then eventually emerges again. But what we can do is we can diminish the number of deaths and hospitalizations by being vaccinated. And if we get to that place where enough people are vaccinated, and the worst that happens to us as a vaccinated population is we get a mild cold-like symptoms because of SARS-CoV-2, well, then we're good. Nobody, as John pointed out, nobody's really too worried about it. We haven't eradicated the common cold. We haven't eradicated the flu. We prepare for it. We prepare for the flu every year by getting a vaccine, and that vaccine changes every year. So in other words, that is one way we can be out of the pandemic. We don't have to get rid of it. And again, this is where the media sort of plays on the uncertainty and plays on the negative rather than on the hope side. And that is that they're saying, well, it'll always be here to stay. Okay, if it is, we know how to deal with that, right? So, and we're learning better and better how to deal with that. So if that requires a booster in a year, so be it. We can do that. That's the wonderful thing. We've come a long way since collecting scabs from cow udders and scratching them into people's arms. So I think we're, I would celebrate that. And I think that's a really important point to remember, is that we've got a lot more tools in the tool chest than we used to have back in the day.
Thanks, guys. A question we got in the chat: any update on the Johnson & Johnson vaccine?
At the risk of being too wordy, I'll just share what I do know, and then hopefully others can add in. The Johnson & Johnson vaccine was having some problems with its approval, not because of the vaccine itself, but because of some of the manufacturing plants that were and manufacturing practices. So that was really the issue, is more around the scale up of getting enough vaccine and this, and all of the ingredients that go into the vaccine out. So, I think that is all being addressed currently, and we'll hopefully hear more soon. Does anybody else have additional info, or would like to make sure that I'm not erroneous in my info?
I think what you said, Nicole, is the latest update. That's the latest that I've seen, that it appears to be effective, but there were a few things that they wanted to address right at the end of the approval process. But it's looking good. Okay. And one of the other things that I saw recently too was that with the Moderna vaccine, I believe, you may not have to keep it at the -80 temperature in order for it to remain an effective vaccine. So I think we ought to follow that a little bit further too. There are some releases that say it may be able to last a lot longer at normal freezer or even refrigeration temperatures than they thought at first. So we just have to continue watching that.
And I think we have time for one more. It seems like all of the COVID-19 vaccines coming out are leveraging the spike protein to create immunity. What's so special about the spike protein that all the vaccines rely on it?
The reason that people are, the different companies are addressing immunity against the spike protein is because the spike protein is what the receptor is on the virus for a complementary receptor on a human cell so that the virus can get inside that cell and multiply. Think of it as a lock and key type situation. Think of the receptor on a human cell as a lock and the spike protein as the key that allows it to attach to that human cell. So that once it gets attached, then the human cell membrane encloses and envelopes the virus particle and takes it into the cell. Then the virus can then start to multiply within those cells. Virus all by itself can't multiply. It has to incorporate itself into a viable living cell, another cell, in order for it to multiply. So until it can get in that cell, it's just hanging out and not effective against at causing any kind of a disease. So if we can stop the incorporation of the virus into a human cell, then we're really cutting down on the disease. The antibody then is directed against the spike protein. It covers up the receptor on this protein. It doesn't allow it to insert into the receptor on the human cell, and then that way prevents the infection of the human cell. The cell-mediated immunity, on the other hand, is inside the cell. And well, we've got different types of cell-mediated immunity, but a cytotoxic cell-mediated immunity is the one that once the virus gets in the cell, then it can attach or it can attack that cell and destroy the cell before the virus can multiply in the cell. So we've got a two-pronged attack, both the circulating antibody and the cell-mediated immunity that should prevent the virus from multiplying in the host body.
That was a great explanation, Bob. Thanks.